Hello everyone, this is Dr. Tejaswi. Today I want to give you some information on food poisoning. Food poisoning are the symptoms which we usually experience when we eat something which is contaminated or polluted with either microorganisms or any sort of chemicals. In the past 10 years, the food poisoning cases have been on rise. Nearly there is threefold rise in food poisoning cases, and the deaths are also increasing day by day. Anyone who consumes unsafe food is at risk of getting food poisoning, but mostly the children, pregnant women, elderly, those who are immunocompromised with comorbid conditions like hypertension, diabetes, etc., are at more risk when compared to general population. The symptoms we commonly encounter with cases of food poisoning is stomach upset by means of in the meaning of excessive abdominal pain, bloating sensation, vomitings, flatulence, or passing loose stools, that is diarrhea, fever. They can be high grade fever too, and extreme headache, decreased urine output. These are the symptoms of extreme cases of food poisoning. Once a patient presents to us with symptoms of gastroenteritis, we usually suspect it to be out of food poisoning. So we usually ask the patient, what is the food taken? What was the food taken earlier? Most of the microorganisms like Salmonella, Clostridia, and Campylobacter, these are all the common organisms, E. coli, which usually cause food poisoning. In addition to this, there are some chemicals which can pollute the food and cause food poisoning. Treatment for cases of food poisoning usually depends upon these symptoms. If the symptoms are mild, like vomitings and diarrhea, we usually ask them to follow symptomatic treatment along with maintaining proper hydration. Monitoring your urine output, especially in elderly, is very important because they are more prone to acute renal injury when they experience any symptoms of gastroenteritis. Any high-grade fever greater than 24 hours should be consulted with physician and proper management should be taken. So any alteredness in consciousness or decrease in urine output, high-grade fever, and extreme amount of diarrhea, all these should be monitored, and if at all they experience any of these symptoms, they should consult their physician. Prevention of food poisoning is simple. Follow or take diet which is fresh and properly cooked only at home. If at all you are living outside, try to avoid food which is being exposed to air and other chemicals or pollutants present outside. If you're taking any processed foods, see that they are properly stored before and they are within the expiry date. If they are out of expiry date, please avoid intake of such foods. If you want to take any foods that are previously cooked and stored, then you should see that they are not stored for more than 48 hours. If at all they are stored within 48 hours only, see that they are reheated only once again. And when you're storing any foods, keep the poultry foods or non-veg items separate from the ready to eat items. Always use safe drinking water, which is boiled. See that your utensils are properly cleaned and thoroughly dried. These are some of the preventive measures that we can follow to avoid cases of food poisoning. Recovery from food poisoning usually depends upon these symptoms. If there is only mild symptom like vomiting or diarrhea, one can recover in 2 or 3 days if proper hydration is maintained. If the symptoms are severe, it may take up to 7 to 10 days for them to recover. Safe food by all means and all sources only indicate that is which is properly and thoroughly cleaned and cooked at home. So I advise all of you to take only home food which is thoroughly prepared. If at all you you ought to take food which is outside. See, one you can smell or see the texture. Change of any of them usually indicate the food is stolen and such food should be avoided.